Thank you بجد دكتورة نشوى. Good evening everyone. I am Dina, Assistant Lecturer of Endocrinology, Tanta University, and I'm going to present a case study in just 5 minutes, so please give me your attention. An exclusive study in just 5 minutes. Ectodermal dysplasia associated with latent autoimmune diabetes, a rare case report. So regarding medical history, a 31-year-old male patient visited the endocrinology clinic with the chief complaint of just high blood sugar level. He has a past history of diabetes for 5 years on insulin therapy in the form of basal bolus regimen, and there was no history of birth complications during delivery. So 31-year-old male patient, diabetic on insulin. Other history, recurrent chest infection, recurrent eye infection, and diminished hearing in left ear since childhood. On clinical examination, the patient has a very special facies. You cannot skip that. Look at this. Very lightly pigmented hair, very thin or almost no eyebrows, no eyelashes at all, mid-face hypoplasia, gives him an older age, saddle nose, thick everted lips or double accentuated lips. So very special faces, yes? But normal nails. On oral cavity examination reveals that complete absence of teeth since birth. There is no just one tooth. Slight elevation of temperature was observed, and on questioning the patient, he reported surprisingly that he has no sweating since childhood. Here we think that the defect is in the parts derived from the ectoderm. You all know that the ectoderm is the outer layer of the embryo, which give origin to skin, hair, nail, teeth, sweat gland, and other derivatives. So our thinking drives toward what's called ectodermal dysplasia, as this is the typical phenotypic features of it. Regarding investigations, fasting blood glucose level was 250 milligram per deciliter, postprandial blood glucose level was 140 milligram per deciliter, and anti-islet cell antibodies and glutamic acid decarboxylase both were positive, which is the hallmark of latent autoimmune diabetes of the adult. So we reported the first case, ectodermal dysplasia associated with latent autoimmune diabetes of the adult. Previously, it was described with other anomalies such as related to external urethral sphincter, cleft lip, cleft palate, but this is the first case of the both association. What is ectodermal dysplasia? As we said, it's defect in the ectoderm, which give derivative to skin, hair, nail, sweat gland, and also other derivatives such as part of the inner ears. This explains why diminished hair since childhood. Part of eyes such as tears, so recurrent infection. And it is categorized into subgroups according to the defect. If the defect is in the hair, it is subgroup 1, in the teeth, subgroup 2, in the nail, subgroup 3, in the sweat gland, subgroup 4. So our patient was subgroup 1, 2, and 4. He has normal nails. About treatment, unfortunately no specific treatment, just conservative. Artificial tears for the eye, dental intervention for the orthopedic, and cooler places regarding the hot temperature. And finally, my discussion will be a patient presented with uncontrolled type 1 diabetes, I mean latent autoimmune diabetes of the adult, with a very typical phenotypic characteristics of ectodermal dysplasia. The international prevalence of ectodermal dysplasia is approximately 1 per 100,000 births. The commonest variant is hypohidrotic, which is commonly X-linked with full-blown expression seen only in males. And finally, the first exclusivity here is the association of latent autoimmune diabetes of the adult that is not previously described in the ectodermal dysplasia. I'm proud to be part of this teamwork, and thank you.